The unique pinel butterfly cuff is able to secure a limb simply and very quickly. When applying the cuff, firmly hold the gray tab at the end of the black portion. Strike as close to the wrist as possible, angle slightly away from the wrist, push firmly downward, then apply the white portion. Remember, black first, then white. The most common error in applying the butterfly cuff is trying to align the cuff into a perfect tube shape as you would with any of the restraints currently available. Not only does it take too much effort in stressful situations to do this, it also opens a significant gap near the hand, making it easy for patients to pull out of the cuff. It also creates a tight spot on the thickest part of the wrist where it cuts off circulation. Combined with the waist belt, the limb belt is useful to prevent strikes, scratching, tube pulling, or other self-damaging injuries. To prevent the cuff from being pulled off, cover the cuff with the small lateral strap and lock the strap tightly. Pass the long end of the limb belt through the waist buckle and attach it to the same pin that holds the waist belt onto the bed. The amount of arm movement can be delicately controlled by the length of the strap. In this case, the patient is able to use hands and fingers for self-feeding or grooming. By controlling the distance of arm travel, the patient is able to turn in all directions, but unable to remove an IV or cause other self-injury. If the patient strikes outward, the arm can be quickly controlled by a distant pull of the long strap. Wrap the waist belt flap snugly across the valley of the patient's waist. Pinel does not recommend allowing the passage of the hand between the patient's body and the belt. If it is too loose, the belt could move to a dangerous position. However, tightness should not interfere with breathing. Ensure that the straps align with the patient's waist along the belly button or valley of the waist. Bias the waist belt to one side and attach it by passing the attachment strap through the rolling buckle and locking it onto itself. Move to the other side of the bed and attach the other attachment strap to the waist belt. Pull this strap very tightly in order to bring the middle portion of the waist belt into the middle of the bed. The two pins are in position to lock in the pelvic strap if required. Even without the use of the pelvic strap, the redundant lock is an additional safety advantage. Side straps can still be inserted for exceptionally powerful patients. These straps can also be used to limit patient roll motion. For example, they can be used to prevent a patient from rolling in one particular direction or to keep a patient positioned on the side. To apply the pelvic strap, first remove the Velcro cover from the black Velcro portion of the pelvic strap. Fasten the Velcro of the pelvic strap onto the Velcro on the main portion of the waist belt. Then pass the loop upward between the bed and the belt. Pass your hand under the interlocking straps and grasp the loop, pulling it through the straps. Pass the main portion of the pelvic strap through the loop and tighten. Finally, pass the strap through the patient's legs and attach it by two buttons to the waist belt. To allow for rotation and prevent irritation, we recommend leaving a 1-inch space between the crotch and the strap. For a firmer hold on the waist, we suggest folding the belt over twice. Begin by laying the green trimmed belt behind the patient with the X in the small of the back and the green pockets facing upward. Pass the long straps through the black loops. These are intended to eventually pass under the armpits. Now lay the other straps that were pointing toward the head of the bed over the patient's shoulders. Bring these straps down and connect them onto the pins that hold the waist belt together. Take the remaining strap on the patient's right side and pass it through the pockets of the shoulder strap as close to the armpit as possible. Take the other remaining strap and pass it over an inserted pin on the patient's left side. The right strap now joins this strap on top of the pin. Ensure snug connections. The patient should feel secure and comfortable. They should be able to roll in all directions and sit up without strain. If necessary, to prevent the movement of the waist belt either up or down, use both the pelvic and shoulder belts. Both are connected to the waist belt with 2 pins that were inserted for the pelvic strap. An alternate method to prevent escape from the top of the bed is to use one of the limb straps to secure one of the legs to the bottom of the bed.